Desperate new measures in some states to slow the spread of the coronavirus. As you can see, we are heading in the wrong direction, and we are heading there very fast. We had more cases than ever yesterday, with more than 217,000 new infections.
The daily death toll is also headed in the wrong direction, far higher. Nearly 2,900 people yesterday alone died of the coronavirus. Do the math, that's 1 every 30 seconds or so. Adriana Diaz is following nationwide efforts to fight this surge. Adriana, good morning to you. There is a stay-at-home advisory there in Chicago where you are. Any chance of that lifting soon? I'm guessing not.
Not at all, Tony. You guessed right. In fact, yesterday the mayor said the advisory remains in place. The risk is just too high here and nationwide. In the last 2 weeks, 34 states broke records for new daily coronavirus cases, and that means more patients flooding into hospitals like here at Rush University Medical Center, where admissions are up. And many hospitals nationwide say they're being stretched too thin.
If we don't act now, our hospital system will be overwhelmed.
California Governor Gavin Newsom announced plans to impose the strictest lockdown orders his state has seen since March, after hospitalizations there jumped nearly 200% in the last month.
We are announcing and introducing a regional stay-at-home order in the state of California, fundamentally predicated on the need to stop gathering with people outside of your household.
The order shutters salons and bars and limits restaurants to takeout and delivery only in regions of the state where ICUs reach 85% capacity. The governor expects most of the state to hit that threshold in the next few days. Help is on the way in the form of new vaccines, one of which was already approved in the UK. On the CBS News podcast, The Takeout, our Major Garrett asked Dr. Anthony Fauci why the UK approved Pfizer's vaccine first.
I love the Brits. They're great. They're good scientists. But they just took the data from the Pfizer company, and instead of scrutinizing it really, really carefully, they said, okay, let's approve it. That's it.
Fauci later apologized, saying he has confidence in the UK's scientists and regulators. But a vaccine can't come soon enough. On Chicago's South Side, the crush of new COVID patients has doctors and nurses at Roseland Community Hospital wondering how long they can hold on.
I'm actually afraid that we're going to get overrun.
Nurses like Alma Abad don't just treat COVID patients, she comforts them. In the ICU, she set up this iPad to connect 85-year-old Florence Bolton to her grandkids.
We love you.
We love you. It's that kind of separation that makes losing a loved one to this virus especially cruel, says Patrick Brent. He lost his 72-year-old mother, Janice Brent, to COVID just 10 days ago.
I couldn't go to Chicago. I couldn't be with her. I couldn't hold her. I couldn't hug her. I couldn't even see her. And the last time I hugged her was, a year ago. And she's gone. She's gone.
We have some more developments on the Pfizer vaccine. According to a Wall Street Journal report, the company was forced to cut its production target for the end of the year in half because of issues with ingredient standards. The company said it revised its targets back in November and that the U.S. is still on track to receive its 20 million dose allotment by the end of the year. Anthony?
All right, Adriana, thank you. Those separation stories are so heartbreaking.